So the easiest way to think about auditory processing is if you think about 3 columns, and so I'll do it so that it's to your left. So to your left would be hearing. We have to take a look, obviously, at the peripheral hearing system, air conduction, bone conduction. And the reason I think bone conduction is so critical to take a look at, and to not assume that if air conduction is fine, that bone conduction will be also. Because often when we test, we'll see kids like this who don't regulate very well. If you are testing at the limits of the audiometer, the softest sound possible, and on most audiometers that's -10 decibels, instantly these kids who are super sensitive will respond to that. And if you think maybe it's a fluke, and so you go back and forth and test, they're going to be fairly consistent, probably across the auditory spectrum. There may be some up and down lines that you're going to see on the audiogram, but generally, that's one way that you're going to start noticing that besides what the parents say, now you have some numbers that confirm that these kids are hearing these extremely soft sounds that maybe you can't hear, all right? So air and bone conduction, really important. And then taking a look at all the other things that as audiologists we measure. How do people respond to words? Can they report back? If you say a word at a certain level of sound, what is that average when they get at least 50% correct? What is that sound level? So then I'm going to skip over the middle portion of this 3-column description I'm giving you, because the 3rd column is language. It's the receptive and expressive piece of this. You have to know when you're dealing with auditory processing, is it really a language issue, that it's the comprehension piece alone and the ability then to put language together. So then, in order to figure if all of that, those 2 ends are correct, the middle piece needs to be addressed. And I'll show you a couple of things that many of us are doing these days. We'll get to that in a moment. I wanted just to tell you that one of the best descriptions of attention came from Frank Music, who is the person at University of Connecticut. You've probably heard of Frank. He's written so many books about the auditory system. The work that people do in attention is critical when we're looking at auditory processing, because auditory processing disorder sure can look like an attention regulation issue. We have to sort that out. So some people do more testing in that domain than other people do. For a child, a very young child, and typically we begin measuring auditory processing disorder or dysfunction about age 7. The proviso is that if we can work with a child even younger, even though we may not be able to test formally with measures that are normed beginning at age 7, we can still get a fairly good idea of the sensitivity issue, the supersensitivity issue, and what kids are tuning into and what they're not. It's still important to see those kids, but you may not be able to use standardized evaluations. Okay, so Frank had gotten this quote from Bernstein, and I thought this was quite apropos. So from Jay Lucker, and his work may be known to many of you. He's also a speech path and audiologist. Look how he's dividing auditory processing and see if that makes sense to you. So dealing with the auditory system, but also having to make decisions about what one is hearing, tapping into memory, and this piece about the emotional memory and the emotional system, we're going to talk a little bit more about that in a moment. And then language systems and sensory regulation systems. So I was really pleased when Jay talked about this, because the multifaceted way of looking at auditory processing, combining language, combining this ability to self-regulate, really critical. This is a multifaceted multifaceted approach. Even though you think you're looking at one entity called auditory processing, it's much more than that.
Yeah.